question. What have your health advisors told you your level of concern should be about monkeypox and the cases that are in the United States and around the world?
Well, they haven't told me the level of exposure yet, but it is something that everybody should be concerned about. We're working on it hard to figure out what we do and what vaccine, if any, may be available for it. But it is a concern in the sense that if it were to spread, it's consequential. That's all they've told me.
Here we go again, right? A new mysterious virus. Well, it's not really new, but it's new in the way that it's spreading, put it that way. A virus that is spreading in a unorthodox way, a way that the virus traditionally doesn't spread, or a mysterious way, has popped up, and it is called the monkeypox. Now, I'm sure some of you guys have heard about this virus, mainly because it is spreading in countries like Europe and North America, even though it really only is in Africa, Central Africa, right? And apparently the people who have got it in the countries of North America and Europe haven't even been to Africa, right? So scientists are perplexed in regards to how people are getting this strange disease without actually going to the place in the world where you would be most exposed to it, right? So that is what a lot of people have questions about. Now, Joe Biden has come out here and started fear-mongering about the virus already, saying that, we should be concerned about it. Even though there's not really that many cases, but it's enough where, him and the World Health Organization are warning people that if it continues to spread, then it could be a problem, right? A problem that may or may not lead us back down the road of lockdowns and shutdowns and, a place that I feel like a majority of the American people really don't want to go, right? And I don't necessarily think we're actually going to go there. I'm just saying, right? This happened just, a year ago? I think it can happen again, even though I don't think that it is politically expedient for the Democrats to do that, right? For the Biden administration to have another lockdown. Who knows? So with that being said, I want to read about monkeypox because apparently it is being linked to gay and bisexual men. However, they're coming out here and saying that, we should stop doing that, right? That is wrong to link this virus to just gay and bisexual men, and that it could spread via contact regardless of who you are. So the whole point of this video is just to give a little bit of facts about what's going on with this new mysterious virus. It could very well be that this is just one of those viruses that we hear about like every year that pops up and people get concerned that it's going to become a pandemic or whatever, and it just kind of goes away, right? That's probably most likely what it'll be. But, COVID was one of those viruses at one point, but that actually spread to the point where it became an actual global pandemic that caused the world to shut down, right? So I'm not underestimating the possibility of, this disease getting to that point, okay? So I think it's important to talk about. So let's read here. Monkeypox is spreading, and it is spreading much faster than it usually does. This month, more than 140 confirmed and suspected cases have been detected in a dozen countries across Europe, North America, and Oceania. The first was diagnosed in the UK on May 7th, and the number of cases that have been confirmed in that country has quickly doubled in the past 2 days, from 9 infections on May 18th to 20 infections on May 20th. Other monkeypox cases have recently been confirmed, scattering across the US, Australia, Spain, Italy, Germany, Portugal, and Sweden. The list of countries grows by the day. One of the troubling things that disease experts have noticed with this outbreak is that the patients don't have a clear link to one another. They haven't all traveled to countries where the disease is endemic, like the Democratic Republic of Congo, Nigeria, or Cameroon, nor have they all been in contact with people who recently traveled to parts of West and Central Africa where animals like rodents harbor this virus. But one thing that public health experts have noticed is that most of the infected patients, in fact, all but one of the patients whose sex has been revealed so far, are men. Now, I don't think that's a coincidence. I don't think that is a coincidence, okay? I think that is statistically unlikely for all these patients, except one, to be men, okay? That means that there's probably something going on here. But let's read more here. This doesn't mean we're dealing with a new brand of monkeypox, one that only affects males or one that is sexually transmitted between men who have sex with men. it's still early days for disease investigators who are tracking down exactly how genetically related these monkeypox cases may be and how they might be spreading from person to person. For now, experts are divided on whether we should give much weight to the fact that most of the monkeypox patients diagnosed outside Africa recently have been men. Why some health officials are focusing on men who have sex with men. Professor Jimmy Whitworth, an infectious disease expert at the London School of Hygiene and Tropical Medicine, told insiders that, quote, "We urgently need to find out whether this version of monkeypox is spreading in a new way." Typically, monkeypox spreads from person to person through extremely close contact. The virus can be picked up on surfaces from bedding, clothes, or respiratory secretions, but it's especially easy to get through skin-to-skin contact. Now, here's the thing. I would take all this stuff with a grain of salt, right? Because, when these viruses first kind of come along and, the public starts learning about it, a lot of these scientists really don't know what the hell is going on, okay? They're just making an educated guess. So we really don't know, okay? And if you guys know anything about the history of, HIV, AIDS, people like Fauci was out here telling people that they could spread, via close contact, outside of sex and stuff like that, right? This is what they were saying, okay? Because they really didn't know. So I would take this with a grain of salt. Quote, "You could imagine that a female person living in the same house, sharing utensils and so on with somebody who's incubated it could get it, but we haven't seen that so far," Whitworth said. "That's what makes us a bit suspicious that maybe this is transmitting sexually, and we need to find that out, because if so, that's new. That has not been seen before." Yeah, I mean, it would certainly be something new, right, for this type of virus. Not for other viruses that obviously can be spread through sexual contact. Let's read more. One CDC monkeypox expert says the sexuality aspect is a red herring. Epidemiologist Andrea McCullen with the U.S. Centers for Disease Control and Prevention has been dispatched to investigate monkeypox outbreaks for years in at least 4 different African countries. She says nothing strikes her as odd about how the disease is spreading, at least not yet. Quote, "Even though there's a lot of questions right now surrounding specific populations of concern and how this may be spreading, I think it's entirely consistent with what we know about the virus," she told Insider. "We know this virus spreads via very close contact. That contact can be with another person's saliva, blood, or the pox themselves. The rashes people get with monkeypox are incredibly infectious." All right, so this is a gross image of this. Okay, and yeah, there was a monkeypox outbreak in the U.S. in 2003. So again, I think this is one of those diseases that, hey, more than likely, it's probably just gonna, be in the news and then it'll go away. And I think a lot of people are kind of paying attention to this because of what happened with COVID. When, in reality, we have these type of outbreaks every year. They just don't get as big as COVID. Pus, scabs, all those lesions are chock full of a ton of virus, McCullen said. At first pass, it sounds like this is a strain of virus that's closely related to what we knew was circulating in West Africa within the last couple of years. Typically, monkeypox rashes tend to break out on the face, palms of the hands, and bottom of the feet, but Swedish health authorities said Thursday that in European cases, the skin problems have often been reported to be localized to the genitals, growing in the skin around the anal opening. That's suspicious. That's mighty, mighty, mighty suspicious. You sure this ain't herpes? Right? You sure this ain't the herp? Right? That's what it sounds like to me. But I mean, if the new, cases, the European cases seem to be surrounding sexual body parts and not, the face or the hands or the feet like the normal cases, then, again, to me, that signals something to be off. But they're saying that, hey, monkeypox is in fact not a gay disease. Public health experts and virologists said that the focus on gay men getting monkeypox now is sadly reminiscent of some of the initial reporting about HIV and AIDS 40 years ago. Monkeypox is not a gay disease, and neither are any other infectious diseases. Virus expert and physician Dr. Bigmagla Kasabin Tatanji, public health researcher Kalesko Monkeypox, and another public health expert who goes by Dr. Neuro Frontier on Twitter wrote on the POLS blog, speaking of medicine and health, on Thursday. Quote, "It is unfortunate that this still needs to be said, highlighting how little we have learned from previous outbreaks." The World Health Organization also chimed in on Friday, pointing out in a statement that anyone who closely interacts with an infectious person can be at risk of catching monkeypox. Quote, this includes health workers, household members, and sexual partners. The WHO said, stigmatizing groups of people because of a disease is never acceptable. It can be a barrier to ending an outbreak as it may prevent people from seeking care and lead to undetected spread. All right. So I don't necessarily think I need to read the rest of this, right? You guys kind of get, the gist of what's going on here. There's a lot about this disease we still really don't kind of know, okay, in terms of why in the world is it spreading in European and North American countries, right, aka Western countries. Why is it spreading there? Well, who knows, okay? Some people are speculating that it might have something to do with sexuality. Some people saying, no, it's spreading through close contact. However, again, I think that it is suspicious regardless. Now, do I think that this is going to lead us back to another lockdown? Probably not. But who knows? I mean, Big Pharma may better make some more money off a new vaccine. They basically cashed out on COVID, right? I'm surprised we haven't had a new variant of COVID by now. We probably have. They just haven't said anything about it because it's not politically expedient for the Democrats. But again, one thing we have learned is that vaccines are a money train. So who knows? Maybe that could be the reason why they're hyping this up. Okay, I'm just saying. It's very early. We don't know much, but it does seem mighty suspicious. Let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.